More than one-third of U.S. adults are obese. Obesity-related conditions such as heart disease and diabetes are some of the leading causes of preventable disease. Additionally, the estimated medical cost of obesity in the U.S. was $147 billion annually in 2008. How are some healthcare providers tackling this huge problem? We are about to find out. You are listening to Clinicians Roundtable on ReachMD, and I am your host, Dr. Prathima Setty. Joining me today is Dr. Neeraj Bhushan, an internal medicine physician in practice for over 35 years, with extensive experience with obesity and associated chronic illnesses. Dr. Bhushan, welcome to ReachMD, and thank you for joining us.
Thank you, Dr. Setty, for inviting me on this very important topic which is affecting our healthcare system.
So, Dr. B, how are overweight adults and obesity defined?
Obesity is defined by body mass index, which is calculated by your weight in kilograms divided by square of height in meters. The normal range for normal or acceptable BMI is 18.5 to 24.9.
And how do you classify obesity or obese individuals?
Obesity is classified as BMI greater than 30. It is divided into obesity class 1, which is 30 to 35, obesity class 2, 35 to 39, and obesity class 3, which is 39.9 or higher.
And BMI is really just a screening tool, correct, Dr. Bhushan?
It is a tool which is looking at essentially two variables, which is height and body weight. But my experience is that you need to put other variables in to get a more accurate reading. Over the last several years, there have been other indices which have been tried, like body shape index, etc., so on and so forth. We are in the process of developing an index which will look across multiple variables and hopefully will become standard benchmark for management of obesity.
So, Dr. Bhushan, once you have defined obesity in a patient, what is your initial approach to best take care of this?
It's a somewhat complicated issue because obesity is not related to only one factor. It cuts across multiple lines ranging from socioeconomic, educational status, single parents, depression and psychological disorders. There are so many things involved in an individual when they become obese that you have to sit down with the patient and get to know that patient and find out what are the factors which have led to obesity in that particular individual.
So, Dr. Bhushan, do you set up a treatment plan at the first visit? What is your first line approach?
My first line of approach is I like to spend time with the patient to first get to know them and see what is their perception about obesity, because obesity causes so many other related diseases, chronic medical diseases. So I like to know the individual if they are concerned about their illness and what is the cause of that illness. Are they receptive to the idea of losing weight? Are they receptive to the idea that obesity is causing their other medical conditions? How well they are informed about the illness? So it's a thing you need to get to know the patient.
So what if a patient expresses to you, okay, I've accepted the fact I'm obese, I want a treatment plan. What is your first line approach?
First, you like to see which category patient is obesity category 1, 2, and 3. And then based on that, you have to decide which is the best approach for that individual. You have to take into consideration if the individual has diabetes, hypertension, what medications that patient is taking. You make a very comprehensive assessment of that patient, including their body composition analysis, and then plan the treatment accordingly. It has to be a very structured program, which we offer here in our center. Patient has to be seen on a weekly basis until they meet their goals. And then from there on, the patients have to be monitored on a quarterly basis for not only losing weight, but maintaining that weight loss.
That's a great point, Dr. Bhushan, because it doesn't end in the office. It's more of a lifestyle type of change for these patients, correct?
Absolutely. I think it's the image I have noticed that patients have a certain image of how they need to be, but they have basically discarded that image and have taken over this new image with weight gain. So it's a huge effort to make those individuals understand that the image which they are carrying in their mind, that how we can closely bring them to that image so that they are not only feeling well physically, but emotionally also they are accepting this new image which they had been dreaming about.
If you are just tuning in, you are listening to Clinicians Roundtable on ReachMD. I am Dr. Prathima Setty, and I am speaking with Dr. Neeraj Bhushan, an internal medicine physician, about talking with your patients about obesity. So it's more of a holistic approach that you adopt and you find that is most successful, correct?
Absolutely. It has to be not only a diet program, it should involve emotional support, it should involve activity. So exercise, diet, emotional support, all these things have to come together along with counseling and coaching to help an individual lose weight.
So how do you specifically promote activity in your patients?
We offer here multiple type of activities. We have started Zumba classes for individuals. We have Tai Chi, yoga meditation, stress management. We are also involved with a 5K race which is coming up in May. So multiple activities is an integral part of obesity management.
So Dr. Bhushan, what advice do you have to other clinicians who want to tackle obesity?
My advice to other practicing physicians is first become a friend for that obese individual, because there is stigma still in our society today. A lot of obese patients feel that nobody cares for them. You have to become involved with that individual and support them in all the areas. And I think this is a problem which none of us can escape. Almost a third of the population in US is now obese. And in fact, I was looking at some numbers that obesity is going to cost over $200 billion in year 2017. And if you add the disease which comes right behind it, which is diabetes, between these two, 20% of our healthcare budget will be eaten up, almost $500 to $600 billion. So it's a problem for all of us, and we all need to have an approach to manage this disease which can benefit the society at large.
Well, many thanks to you, Dr. Bhushan, for joining us today.
It was my pleasure to be given this opportunity, and I hope this will help other clinicians to help their obese patients. Thank you.
Thank you so much. I am your host, Dr. Prathima Setty. To access this episode and others in this series and to download the ReachMD app, please visit reachmd.com, where you can be part of the knowledge. We encourage you to leave comments and share this program with your colleagues. Thank you for listening.